All right, poll question, pretty easy. You shouldn't be doing any of those things with people with sciatica or low back pain, and you shouldn't be doing those things with anybody. So let's break down why those are poor choices that should be avoided with every patient that walks in, and more importantly, what we should be doing with a patient who has been told that they have sciatica. All right, so option one, calm down symptoms with the modalities. We should never be using modalities. We should never be calming down symptoms. It blows my mind how many physical therapists actually admit that the first visit is to get the symptoms calmed down so the patient leaves feeling better. That's the whole point of the first visit. No, the whole point of the first visit is to find the root cause, reverse the root cause, and patient leaves with normal function. And oh, by the way, probably also has no symptoms. That's the purpose of the first visit. We never use modalities. We never calm down symptoms. Option number two, get imaging. What for? If somebody comes in with imaging, I don't even look at the imaging that they have. Why would I send them or wait for them to go get imaging? I have the ability to think critically. I understand how neuromuscular physiology and human physiology works. I understand biomechanics. I understand anatomy, all the stuff you learned in school. But the key is I know how to put all that stuff together, which is what you don't learn in school. So if you know how to do those things, you don't need imaging. You can actually evaluate and treat somebody all by yourself and get really good results. So nerve glides, what if this patient doesn't even have a sciatic nerve issue or involvement, which rarely they do. They come in thinking they have something because they either saw a doctor that spent about 2 seconds evaluating them and their evaluation was, where's it hurt? That hurt? Oh, sciatica. Okay, terrible job. Or second best option, they go to WebMD and self-diagnose. Oh, well, that said if I have pain back here, that's sciatica. Normally, people come in thinking they have something that they don't ever have. So if you're relying on a script that has some garbage diagnosis, or you're relying on the patient telling you what their diagnosis is from WebMD, you're already screwed. Forget about diagnoses. Diagnoses don't matter. What matters is your evaluation and your thought processes in order to get to the treatment. Massage and correctives. Well, we know what massage does. Calms down the symptoms and makes people feel better until they feel worse because massage causes more problems because massage and rolling and stretching and whatever else soft tissue you want to add in there only causes more inhibition, which when they let that muscle get in a shortened position after the massage or the stretching or the rolling, it gets twice as tight. And then what do they think they need to do again? The same thing they did before, which is what most physical therapists do. Bad idea. Never massage or roll or stretch a patient for any reason, period. Correctives. Correctives don't exist. If you're giving exercise to people like eccentric and concentric active range of motion exercises, before you assess and reverse neuromuscular inhibition, all you're doing is causing them to compensate more. They're going to get more fatigue, which is going to cause more inhibition, which is why they come back with the same problem or more pain when they get home or the next day because you gave them the wrong thing to do. So obviously the correct exercise was we do none of that stuff. We don't focus on symptoms. Our purpose is not to make somebody feel better. We're not going to make them worse. Or we're not going to wait around and waste their time waiting as a picture that really doesn't tell us anything. So what we should be doing with this patient, so they come in with their referral for sciatica, they bend over, touch their toes, they have no radicular symptoms, they have low back tightness, low back pain, they do a single leg squat, they're unstable because they can't tolerate or control pronation on one leg. So we start putting together the thought process of, oh, we need to assess this and see what muscles that are actually supposed to be controlling pronation are inhibited and why, when they go forward to touch their toes, would they have pain and tightness behind them? Probably the law of reciprocal inhibition. So if we know how to use those things to our advantage, we go and get to the root cause, which is probably going to include some combination of pyramidalis, vastus lateralis, rectus fem, gluteus medius, soleus, abductor hallucis, transverse abdominis, those types of things. We assess those when they're inhibited. We reverse the inhibition, make sure we retest that to prove our work. Then we get them up and we redo our screen, and guess what? They touch their toes and they have no low back pain or tightness. They never had a positive straight leg raise. They never had sciatica to begin with. So if you just jump on sciatica because that's what the script says, you are already 100% wrong. This is why diagnosis does not matter. Assess the person that's in front of you, get to the root cause of their problem, assess gross function, then neuromuscular function, reverse the problems, reassess, make sure they can do what they couldn't do 15 to 30 minutes before, and now you can give them home exercise programs that revolve around and are based on the things that you had to refacilitate. So this is a 100% custom-made home exercise program after you educate them about the things that you were doing before, most likely stretching, massage, rest, ice, heat, need to be stopped. Now, if they want to do rest or ice and heat after, if the home exercise program doesn't calm down their symptoms and they want to do ice and heat, that's not going to make them any worse, but they definitely will get worse if they roll, stretch, Theragun, all that junk. So they need to stop doing that. You're going to educate them as to why what you did is the exact opposite of what they've been doing, which is why they're going to get better in 1 to 2 or maybe 3 visits. So hopefully you answered the poll question correctly because you had the exact same thought process as what I just went through. And if you have questions, post them below. And if you're ready to use this thought process with all of your patients every single day, make sure you DM me and let me know you want in the shift.